Welcome everybody to Solo Spotlight. I'm your host, Ryan McDougall. Um, Common words we hear today: burnout, people pleasing, trauma. These words are everywhere right now. And the problem is they're used so often that people start to think that they mean everything and nothing at the same time. One person says burnout, it means they're tired and they have a bad boss. Other person says burnout and it means they can't function, get out of bed, and they hate their life. So that's a huge difference. So today we're going to slow it down and unpack what's really going on underneath the surface. Without turning this into a clinical lecture, with myself asking questions. My guest today, Lilly from Beyond Roots Counseling in Calgary. She is a registered provisional psychologist and a certified EMDR therapist. She works with people navigating burnout, trauma, anxiety, patterns like people pleasing. Quick note for the audience, this is an educational conversation. This is not personal therapy for myself or medical advice for the general public. If part of this conversation really hits home for you, reach out to a qualified professional so they can do the great work that Lily's doing down in Calgary. Lilly, welcome to Solo Spotlight. How are you doing today?
I'm doing well. Thank you so much for having me on here. I really appreciate it.
Yeah, of course. It's always great to sit down with people that are helping people through probably some of the worst times that they're having and kind of bringing them back out into, a way that they can grasp with their reality or help with their trauma. It's very noble, and I really appreciate the work you do because uh, jobs like yourself are kind of the unsung heroes of the world today. Quick start off, just to kind of get the audience to know who you are. When you're meeting someone for the first time, how do you introduce yourself?
How would I introduce myself as like a person or just like I guess like a
Yeah,
quality?
or like if you were at like a function and someone's
Okay.
like, "Hey, who are you? What do you do?"
Oh, okay. Well, maybe I would be like, okay, well, first of all, I am a human, definitely a little bit of a hot mess, but I am an individual therapist that helps others move forward in their life, live more authentically, reprocess their traumas, and just be there for them, essentially, I would say. Yeah.
Yeah. And what got you into the field of psychology?
Well, originally, before getting into psychology, I come from like a Eastern European household, so they were very set on me, like doctor, some kind of doctor, going into that. And I decided, yeah, I don't want to be a medical doctor. I decided I was like, okay, I want to actually help people in a different way. Going through my own kind of mental health issues throughout childhood and stuff like that, seeing my mom struggles, always things like that. Psychology stuck out to me in different ways, more than one. So I was like, you know what? I'm going to switch my bachelor degree because I was originally in a bachelor of just general like science. And I was like, I'm going to take psychology because I fell in love with the ability of how the brain is able to heal, to naturally kind of heal, which we'll get into later.
Hmm.
But yeah, I decided I was like, okay, I'm going to do my bachelor's in psychology, which I did here in Calgary. I was like, okay, what can I do? I need more of this. I was like, I need to do more. I wanted more after finishing my bachelor's here. So then after that, I decided I was like, okay, I want to get out of Canada because I just kind of felt like, okay, I also need to just see the world. And I decided I was like, I'm going to do my master's in clinical health psychology. And I applied to do that in Scotland, like Glasgow specifically. But I left during COVID, specific, like right in the middle of 2020.
Hmm.
But I was able to complete that master's degree. I knew in the back of my mind that if I was able to just help one person, that I would be good. I would be happy with that if I
Hmm.
was able to just, yeah, change someone's story, be able to help someone heal. I would be happy. So fast kind of forward to doing my master's in Scotland. I did my thesis in at the University of Strathclyde, and it was on on cognitive interventions for youth that suffered from fetal alcohol syndrome, which I thought was super interesting because my supervisor at the time was also kind of working in like incarcerated areas for youth, like jails and stuff like that. So we were taking a look at how cognitive behavioral interventions were able to help youth that suffered from fetal alcohol syndrome. So that was really cool. Loved that. And then, yeah, I flew back to Calgary. Had to take some additional courses and all that fun stuff that comes with licensure, and worked for, I'd say, yeah, a couple of group practices. I started off in private practice, which usually people don't do right away, but I was like, you know what, I'm going to just start off working in group private practice like that, but then also thought like, okay, I need to get more experience. So I decided to work on the front lines of like substance use and homelessness and addictions. I worked for 2 years in that area, which I absolutely loved. It was an amazing, amazing experience. And I just absolutely loved the clients that I worked with. And then after that, worked for another group practice and then decided, okay, I feel like maybe this is time to spread my wings in a sense of like, okay, I kind of don't fit in anywhere here
Right,
with these
right.
group practices. I'm like, maybe I should try something, like practice what I preach, right? The authentic self of like, okay, maybe I can promote also the values that I have within therapy and be able to kind of do this in my own terms. So that's kind of
Hmm.
how Beyond Roots Counseling was born, but it's
Right.
still a little bit of a nutshell and still a baby. But yeah, that's
Yeah.
kind of how psychology came to be in a sense.
Yeah. That's amazing. And what I find interesting too is kind of you were able to experience like this lived in experience of between here in Canada and as well as in Scotland, right?
Yeah.
Um did you notice there was a difference in how like people like carried themselves or like say the people that you like worked with or you studied with, did you find like their ability to handle stress was different based on like where people lived in the world and like their like economic
Yeah.
life and stuff like that, and kind of was that something you were able to take back?
It was amazing to see. Like, it actually kind of humbled me because it's like a lot of times, like, like in Europe in general, well, in the UK and stuff like that, it's like, it's more of like a, not like, I wouldn't say like a calm life, but they do definitely value like more of like socializing, more of like self-care, like let's say in that sense. And like they really just kind of enjoy living. Like there's also like there's things, for example, like yes, people are working, yes, they are also kind of career focused, but they also take the time to kind of focus on, yeah, like friendships, socializing, doing things for themselves, which I have never seen before
Right.
because we've kind of been really normalized to like, okay, working till like the end of time, like really just kind of like being like you said, the burnout, right? It's like just the go 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 notion of like not stopping, not being able to just kind of pause, not taking time for yourself. And especially being there during COVID, it was very interesting to see like the individuals, like they were still kind of enjoying the outside, they were still doing things, they were still like having picnics, like they like
Mhm.
life did like life didn't just stop in that sense. They were still able to kind of, yeah, be able to like put their nervous systems like first in that sense, which was so
Right.
interesting to me. And I definitely took it with me when I first came back. But then it definitely, within the next couple of months of being back in the kind of sense of mentality of like, okay, no free time, work, work, work,
Yeah.
gotta go.
This like North American like
Exactly, the North American
attitude.
lifestyle. It was like I always think of, if you ever watch SpongeBob, I always think of him as a very visual person when he's like holding all these things, trying to do everything at once. And I'm like,
Yeah.
that was me. And that was always the lifestyle that I thought was like, okay, that isn't that what we do? Like we're supposed to kind of just keep going, keep doing things, figure it out, like no breaks, work through break, 5 day, well, eight day work week,
Yeah.
whatever it is, working
Yeah.
48 hours, having your phone on you all the time, right? Like we never really were taught otherwise. So it was
Right.
so interesting seeing like more of like a slower life, and people were okay
Yeah.
with that. Like they were happy.
Yeah. Do you do you find it interesting, especially when you look at like pursuing something, like especially in this type of training, you're almost in like a paradox where you're training to like heal people, but like you're also like pressing yourself as well to like, I got to get this done and I got to learn this and I want to get to this part. And was that kind of like a challenge where you're like, I have to almost practice what I preach in a way? And like, what did that work life balance look like for you when you were trying to do that? Because especially in this field where it's like, oh, I can't experience burnout myself if I'm trying to teach people how to like properly handle burnout, or I'm, you know, and what did that experience look like for you? And was that kind of something, was that like a notion that you took with you, or is it kind of like you're also a human being and you also go through that type of stress as well?
Absolutely. And like at first, when I was first kind of within, well, not at first, my whole life, I'd say, until kind of now, until I became a practice owner, I would say I was always kind of followed under that, like, yeah, that notion of like, okay, we're just gonna go. Like, I also neglected my own self care, which was very difficult because, like you said, that dichotomy of like trying to practice what you preach. But it's like, how
Mhm.
do you do that when you have to have all these things, do like you have all these classes, all these people that are depending on you, all this like stuff that just keeps adding up. And it's like
Mhm.
everybody thinks that therapists like have it all together and we're
Yeah,
all this
you guys
like,
are
okay,
bulletproof.
absolutely. And that's like, I actually kind of like nowadays that that notion is being a little bit broken because now more of the authentic relational therapists like me are coming out to show like, okay, yes, we have this training, we are professionals, but we are also human. Like, this is why we want to show you that like therapy is real because it's human. It's that ability to connect with one another, to like build that contact so that we can then move forward and heal together, right? It's
Mhm.
if And that's the thing with the fit, right? Like, everybody isn't a good fit for everyone, right? That's why
Mhm.
everyone has their own preferences. Like, if you want someone that's more clinical and more like um professional in that sense, that's absolutely someone that's out there as well. But nowadays it's like, I would like, in my sense, like my therapist, I wouldn't want them to be like a robot. Like, I want them to laugh
Right.
with me. I want them to enjoy I want them to tell me that like they're proud of me. And like, obviously there's boundaries and ethics. And of course that comes with it. But it's like, I just also want to know that they're a human behind it all too.
Yeah, of course. Um, when you talk about like getting into therapy and through your training, was there any like big misconception about therapy that you kind of learned was like a very prevalent thing that was like, oh, a lot of people think this, but now that I have this kind of exposure and training, it's like so far away from the truth?
Absolutely. So I definitely feel like people kind of talk like the taboo of the therapist on there's the couch and you're just ranting away in your life, and like just kind of that therapy is just like talking about your problems endlessly or reliving trauma. You can definitely talk about your problems. That's totally fine. But like, I would say like good therapy is, yeah, about building safety and like rapport with the therapist first. Like, that therapist client relationship is like absolutely number one, so that you can understand those patterns together, work as a collaborative team so that you can move like at a pace that your nervous system can actually handle. It's not just like
Mhm.
hear, like just like all of a sudden hear everything all at once. Like, it actually isn't linear. It's very much like taking it one step at a time and focusing on what the individual really is needing.
Mhm. Was there any like secondary skills that you had to learn as like getting into therapy and psychology where like for me like say I'm like podcasting, I'm interviewing people, like I had to figure out early on of like, oh, I have to like listen to understand and not listen to like ask the next question. Was there any like type of skills that you had to learn, or like I have to be more conversational, or I have to be a little bit more like welcoming, or was there something that didn't fall like in your normal like lived in life that you almost had to be like, oh, this doesn't have to really do with like the idea or like the logistics of therapy, but like it would definitely aid in making my patients feel like, our clients feel like a little bit more comfy or safer?
Absolutely. So with especially with the trauma work that I do now, like body language is huge. I would say like being very like open and like warm with the way that you speak, like intonation of the voice, also like securing the space for the client. So for example, like I really like having like comfortable things in the office to make it like welcoming. For example, like warm drinks, cold drinks. I have
Yeah.
like
Stuff
um
on the walls.
stuff on the walls. I have
Yeah.
aromatherapy going. If you don't like that, I'll turn it off. I have very dim lights. I have snacks. Take your shoes off, take your socks off. Do whatever you want. Lay on the
Right.
floor. I have mats that people like to just kind of ground and lay on the floor. So I'm like, I really just want to make it as comfortable as possible. And then also just like um being honest about things. Like I'm like, if you don't like something, or if something doesn't resonate, or if this is like absolutely like a no, you please let me know. And just, yeah,
Yeah.
like being able to give them the time to just like pause and reflect. Because sometimes I like to just, yeah, like we just like to talk as human, or say the next thing, or like just keep going. But sometimes I notice, like I was like, okay, that secondary thing of like just letting them like speak, or like giving them that silence or pause to kind
Mhm.
of let them reflect on what was just said was definitely an important thing to learn.
Yeah. It's interesting that putting people in the right environment like almost aids their healing, like even just as much as like a conversation, because it's like that's like your initial like I could close this person off if like I bring them into like a brightly lit room with bare walls and uncomfortable furniture, and like because then all of these like secondary things of like instead of talking about their trauma or like going through it, they're thinking about how like uncomfortable the chair is or how it's cold or whatever it is. And it's very interesting because it's like these same practices are used for like police interrogations where it's like they sit you in the corner of the room, you can't see the door, like little things where it's like these little psychological tricks that definitely aids you. But it comes with that like experience where you start to learn like this is what works for certain clients, this is what doesn't. And when you talk about like having your own practice and like working with clients, what when you talk about like getting to the roots of things, like how does that actually like come out in real life? Like how do you know when you're like getting to the root of a problem and not just like a symptom?
Yeah, absolutely. Well, and especially within like my name, like the way that I kind of came up, like beyond roots counseling, and the therapy that I do is like literally being able to like heal beyond the roots. So taking a look at your life, and especially where the root kind of comes from, and it's
Mhm.
uncomfortable, and sometimes we have to feel uncomfortable to heal, but where the root usually lies is where we build those patterns, when that's usually kind of that childhood sense, right? So, for example, like if we know that the same pattern that has been coming up since we've been like 7 years old is still coming up nowadays when we're an adult, there is something that is still kind of stuck there within that nervous system that keeps repeating itself. We keep doing the same thing over and over again because we think that it's helping us. And maybe it has helped us, right? Because there is no bad parts in that sense. But now it's like, okay, we need to recognize, do we want to pull the root out? So do we want to get to like the bottom of where this all came from, or do we want to just look at the stems? And that's okay too, right? Because we have to meet the client where they're at. But essentially
Mhm.
it's like, okay, if we want to really pull out that root, we got to go beyond. We got to go beyond.
Mhm.
And that's beyond treating the symptoms. So beyond treating those leaves, because if we treat those leaves, that's fine, but something will happen in our lives that will come up again or trigger us that will then revert back to that original pattern where it came from.
Mhm. Um I like the idea that symptoms are the smoke and the root is the fire, right?
Yeah.
Um, and what are the most common fires that you see behind like burnout and people pleasing?
Yeah. So this is, well, with burnout, right? It's like, it's just trying kind of to do everything all at once, like, right. And it kind of goes together, right? So like with burnout, a lot of times, like you're already at that point of like everything is already so mentally exhausting. You're just doing things just just like as like they're coming. It's kind of just like there's no time for yourself. There is no actual relaxation of your mind. You're just constantly go go go. And with people pleasing, it kind of goes hand in hand depending on what trauma response you do more of. But people pleasing is also known sometimes as fawning. So for example, like people pleasing can be like saying yes all the time, being more agreeable, being the one that's in the room that's like the quiet person, the easygoing one, the one that says yeah yes all the time because that's what you've learned that keeps you safe. Like it kind of is like, okay, I can make this situation all right if I just let the things that I want go and focus on someone else. So
Almost like a
sometimes
survival instinct.
exactly, exactly. And it doesn't mean that you're broken. It means that you've learned that this is something that keeps you quote unquote safe, or kind of like mediate the situation or make sure that everybody's happy or whatever it is. But everybody else may be happy, but what's happening internally for yourself is there's just too much on your plate right now, but you can't set those boundaries right now because that's just too difficult, or you haven't learned that right now. So it's like that burnout and that people pleasing can cause this like spiral of this pattern. And it's like, okay, usually that's when people are like, okay, I can't take it anymore. That's when they're like, okay, I need stress leave, or other things happen, or negative coping mechanisms. Or then they're like, okay, maybe I'll try therapy. But then everything is just so activated in that moment that it's like, okay, what is really going on in our nervous systems? It's like, okay, our
Hmm.
burnout has kind of manifested more of like, okay, this is now like mental and physical exhaustion in a way that we can't really tolerate it anymore.
Hmm. How how do you tell burnout apart from stress? And when you bring it further, how do you like separate that from someone that's having depression?
Yeah, yeah, because a lot of times people will think it's like hand in hand, similar, and it may be similar due to like symptoms, but stress usually, like if it's just regular kind of day to day stress, work stress, stuff like that, it's usually like short or long term, and you can usually recover from it. There's usually like an end point to the stress. So, for example, like, okay, whether this is work stress, I know that this big project will be finished or whatever it is, I will feel better afterwards. Or if it's stress at like family stress, something like that, like some type of stress in that situation, you can usually tend to recover from, whether it's emotionally or whether it's within your nervous system. But there's also a difference between like good and bad stress. So yeah, bad stress, whether if it's like negative things that are happening to you that are within or out of your control, whether that's like, yeah, just things that happen on a day-to-day basis, like just stuff that you can't control. Or there's also good stress. So good stress could be like um, you're getting ready for interview for a job, so you're stressed out, but it's like a kind of positive outcome that's going to happen. Same thing with like a graduation or a wedding or anything like that. Kids can kind of cause both a little bit sometimes, good and negative stress, right? So it's like that type of stress, there's usually like some type of endpoint, even if it like is like years, whatever that may be. um there is some type of like endpoint. But with
Hmm.
burnouts, like, and not like going too far into things, like burnout can lead to like chronic stress. So, like
Hmm.
chronic nervous system overload. So, like, this can lead to like PTSD, feelings of like just kind of like complete hopelessness in a sense. So that's where that depression piece kind of, those symptoms
Hmm.
can arise as well. But burnout is where you've kind of, not in a sense met like rock bottom, but your nervous system is just completely disconnected from your body. So you're
Yeah.
basically just going one way and your body is kind of pulling you the other way. So that's
Right.
also like, that can show up in like lack of sleep, irritability, like loss of relationships, just a lot of constant chronic overload of your nervous system. Same thing with like gastrointestinal issues, a lot of physical things as well. So this is definitely more of like a long term feeling. And then
Right.
depression is more of like a clinical diagnosis. You can experience depressive symptoms, but depression in of itself is more of like a global mood diagnosis. So it's like lack of self-worth, motivation, and it's different from actually experiencing the depressive symptoms itself. So you would have to be diagnosed with depression if you actually
Right.
were depressed in of itself. So that usually lasts for a certain time period of time as well.
What do you find that are some like early signs when someone's at like the level of burnout? What are some early signs that like you can catch when you like talk to someone?
Yeah, so definitely first taking a look at like what does their day-to-day life look like from kind of like morning to night. Is it like balance looks different for everybody, but is there any time that they're spending looking at their like physical health themselves, their mental health, or does it just look like doing things for others all day,
Yeah.
neglecting their like their nervous system? Does it look like just kind of working all day, or does it look like maybe like isolation, or
Yeah.
completely kind of just putting themselves in a corner or being alone? And also taking a look at what their like physical health looks like. So for example, that looks like sleep, diet, social life. Like what does that look like? So if that
Yeah.
is totally like out of whack, depending on what their schedule is, because everybody is different, that can definitely show like, okay, you're prioritizing everything else other than yourself, and what's going to happen is your nervous system is just going to shut down. So that's either going to look like like, for example, for somebody that may look like a depressive episode, or like a panic attack, or just like sleeping throughout the day or anything like that, or just not showing up at work, or like those negative coping mechanisms, completely isolating themselves, not sleeping, not eating. And then that's when it starts to just really take a toll on you, because this is then that long-term chronic stress. Then that becomes the burnout.
Hmm. I have an interesting question. I think this is this is more of like an opinion question, but
Okay.
why do you think that the most capable people crash the hardest?
Because they were never taught how to slow down.
Yeah.
Because
Yeah.
the thing is, success is always defined by doing more, by achieving more, by doing all these things, or whatever that may look like for people, right? It's like the the individuals that are able to prioritize what they need first are the ones that are the most successful, because their nervous systems are getting exactly what they're supposed to be getting. They're not in overload.
Hmm. Yeah, that's interesting. Because you always find that, like, a lot of people, it's not the fact that they're not capable of doing it, it's the fact that they don't have the systems in place to manage their own emotions. And yeah,
Yeah.
it's um what are three realistic steps that someone could do in the matter of a week to reduce uh like symptoms of burnout?
Three realistic steps. Okay.
Like if
Yeah.
if someone hasn't like went to therapy, or like
Yes.
they're,
Okay.
and they're just like trying to get through life, and like kind of something that someone could pick up, whether that's a breathing exercise or staying grounded. Are there like easy things that people can implement in their life that can like significantly decrease like the level? Like for me, it's like writing things down and
Yeah.
like getting it off of my brain onto a paper, and it kind of like relinquishes like the responsibility of me to like keep this all in my head, right? But like that works for me. But sometimes it's as simple as like, yo, don't drink 10 coffees a day, and like maybe you won't be as stressed, so what are some like, some very like nuanced things that someone could do to like, implement into their lifestyle to help with like these feelings of burnout?
Yeah, well, it's honestly, sometimes people are like, "Oh, it's easier said than done," right? But like doing one thing for yourself at least a day, whether that may look like, okay, I'm going to make myself a nice coffee, I'm going to take myself out for a walk, because it's like something small that you know you're going to like, that you're going to start your day off, whether it's that $7 latte that you know that you're going to like, or because saying no right away, if you're already a people pleaser, is one of the hardest things that you can do. So if you're used to just already having all of these things on your plate, we have to really slowly kind of like taper that, and like manage that in a way of like, okay, you've been used to doing this all your life. Let's figure out a way that we can start to slowly remove this pattern, and then start to be like, okay, let's see if we can try to do say no to maybe one thing a week, something that we are used to saying yes to. Maybe that's like, okay, taking this person out, or whatever it is, right? Like something that's more manageable and able to actually work for you. So not overloading yourself like you're usually used to. It's like taking things off of your plate. So being able
Hmm.
to be like, okay, I'm going to try to do something for myself first today. And then also starting your day off with some kind of vitamin D. I know that that's like so cliche, but whether that's like just like some sunlight on your skin for like 5 minutes, whether that's like a happy light, whether it's going outside and just forcing yourself, even if you hate it, it does really just start your day off just feeling much more motivated in that sense. And with
Mhm.
burnout, just moving forward with that, if you're already there, um, support system is huge. So who you surround yourself with, if people are already negative and kind of just draining your energy, that's not going to help you feel better about yourself. So really just focusing on surrounding yourself with people that you know make you feel good. Or if it's like, if you don't like people, if it's whether like if it's animals or whether it's just kind of sitting in a calm place that you enjoy as well, and also adding in like slow bilateral taps, things like that, like thinking of things that make you feel good, whether that's even like a warm drink, and then just holding yourself, giving yourself a little butterfly hug, and just bilaterally, slowly tapping. And it just starts to nice and calmly just ground you automatically. That also helps in that moment, especially when you're in the situation in of itself. But definitely long term, of course, I would suggest, yeah, talking to someone, whether that is a therapist or just a friend, and just like
Mhm.
mind dumping or talking to them about what's going on. Holding everything in or kind of keeping it to yourself is personally, in my opinion, not the best thing to do, but it's sometimes difficult to open up. So yeah, like you said, journaling, if that's something that people are comfortable doing, or just literally, yeah, like a mind dump, like not even writing down like what's been going on, just like words, things that kind of like patterns, themes, stuff like that. Anything that can just really like give that nervous system a break, like kind of a release, kind of like a catharsis in that sense.
Mhm. Do you find when you are kind of dealing with new clients, is there often the notion that the client thinks that like this isn't something that I need? And
Oh,
is that like a boundary that, or like a barrier that you almost have to fix first, where they're like, yo, work told me I had to be here or whatever it is, but like I'm good. And like how does that conversation look like without like diminishing them? And like cuz I feel like that's probably like the first initial hurdle of like it's okay to be here.
absolutely. And it like a lot of times like therapy is met with resistance or like the magic question of how many sessions is this going to take? We're
Yeah.
because we're not trying to fix you. We're trying to help you move forward from negative patterns and live a better and authentic life. But yeah, the first thing is like normalizing that. Like definitely in my sense, like if you feel like you don't need it, like that's okay too, like whatever that may look like, right? But also knowing like in a sense that first the most number one step is I guess like acknowledging that resistance, and then also like building our relationship with like one another so that we're comfortable, because a lot of times it's difficult to talk to a stranger about things that you don't want to talk about, that are uncomfortable, that are probably going to bring something up, because normally like even if you bring something up to do with whatever it is, it usually causes a tangent or whatever it may be, right? So there can be a lot of resistance when it comes to therapy, but it's just really normalizing that experience, that it's okay that it's weird. It's okay that
Mhm.
this is like a off experience, but it's like we're going to make this work for the both of us. We're going to try to make this a collaborative experience, and I'm going to be there for you, and we're going to lead this together, but also knowing like if it's not a good fit, that's okay too. And having like those good referrals and knowing like, okay, how, like when to refer, kind of like, okay, how is the client comfortable? Like really just checking in with the client, because essentially before moving forward with anything, definitely the relationship and kind of building that comfort first is definitely an essential piece. And then the resistance usually does die off.
Mhm. And it's interesting too because as complicated as it is and as complicated as like all of the different types of way to get people to talk about their trauma and go through burnout, it's there's also this notion of like staying realistic and going like, yeah, does this feel kind of like shitty or uncomfortable? Well, like that's like that
Yeah, it's
that's
gonna have
normal.
to.
Yeah,
Yeah.
like that's kind of normal and that's okay. And I think that that's like a big hurdle for some people is like this idea of like uncomfortableness or like, oh, it's not gonna be like boom, I'm gonna like catch it right away. um and this kind of brings us into like having boundaries and like people pleasing and like for the audience, like for the research that I've viewed is like people pleasing is described as patterns like neglecting your own needs and
Yes.
living under others' expectations. Correct?
Absolutely. Yeah. Just absolutely like saying, like putting others people needs before yours and just learning
Hmm.
that like as that to be safe.
What do you find is the most common emotional price that people pay for like high levels of people pleasing?
I would say resentment for sure, because
Hmm.
what happens is sometimes with people pleasing, like you expect the person to kind of do the same thing back for you, or you're like thinking, okay, like I'm going to do all these good things, I'm going to help these, I'm going to do it, and then this person is going to do the same thing back for me. And sometimes that's not how it goes, and then you just kind of keep doing like all the things for these people or whatever it is, or it's not setting boundaries. And yeah, a lot of resentment, and definitely a lot of like feelings of maybe like just yeah, like just I guess like not, maybe not even not good enough, but like not being able to yeah, put themselves first. So for example, like not viewing themselves as yeah, important. So
Hmm.
that can cause negative cognitions to form. So kind of like yeah, like I'm not worth it, because it's like I keep putting myself first in that sense. So
Yeah.
it can really develop like internal messages of oneself that are not true.
Hmm. And yeah, it creates like this false feedback loop of like you're almost expecting like, oh, I did all this for you, and now like the expectation, and it's kind of weird because like when you have these conversations, is it like a notion in your head of like, how do I actually like approach this subject without like diminishing their value further, saying like, oh, like why would you think that? Like why would you expect that someone would return that favor? And like how does that like realistic discussion like blend with like an actual like approach that can benefit them in the future?
Absolutely. And that just goes with, yeah, again, like normalizing their experience that what they're doing is not wrong, and that they're not broken, that they're not damaged. It's just whatever that they've been doing. Like this pattern has not been causing them any positive things to happen. Like they've been the ones that have been suffering. So take like making them kind of take a look from the outside in, really, in that sense of like viewing the external internally, and just really just being able to talk to them in a sense of like understanding like where they're coming from, knowing like okay, this is something that's deep rooted, this has been here all your life, that's been to protect you, to kind of keep you safe from whatever it may be, whether that's family members, at work, whatever it is. And now it's like you are learning that okay, I don't like this anymore, and we are now going to recognize together like okay, you deserve better for yourself, and how are we going to now move forward and now slowly be able to like remove these patterns and kind of see what the truth is, which is not going to be super comfortable. But if you're ready and willing, like really knowing like we can do this together. And again, acknowledging that like therapist relationship and making the client feel comfortable, because where the people pleasing usually comes from is usually stemmed from like a childhood or like a trauma stance of like okay, this is keeping things okay. And sometimes people don't feel comfortable about acknowledging those things, so really just yeah, being able to take that experience slow and just talking to them and normalizing that it's okay that they do this.
Do you think like people's level of introspection is like a skill that people have or like they can learn, or is it like you have it or you don't?
I think definitely you can learn it if you want to, because sometimes like people are also really good at avoidance too,
Mhm.
and you can learn how to do that as well. So if you're willing and open to learn and be aware, then absolutely. But it's very difficult also because introspection requires reflection. Well, that rhymed. That, but it
Yeah.
does, because like looking inward is uncomfortable, and usually if people are just kind of not, it's easier to live in that kind of comfort zone, but that's also like living in ignorance, right?
Right.
So it's like okay, are we willing and ready to look at this, and it is uncomfortable, but there is a beautiful light at the end of the tunnel, or are we just going to be okay to just live in like the abyss of whatever? And that's
Yeah.
okay too, right? Because sometimes that's more comfortable for people as well.
Yeah. I always make this joke with people that I work with where I say like it's like this weird like curse that people have where it's like introspection is like this paradox that's like it's great to have, but it almost like makes your life so much harder because like you're aware of so many more things. But is there a way that you can kind of narrate that in a way to get the right, like the right amount of feedback that you need? And how do you balance that out of like how is there too much introspection? Is there almost like you're doing too much? And is like there's like levels to like, okay, like that doesn't matter, but that matters, and that doesn't matter. It's like, so you told me to look inward, but like now I have to
No inward
determine
is this.
how, yeah, like how far I have to look, right? But I like imagine just being the person that thinks everybody loves them and works great, and I have no performance issues or whatever it is. And so it's but that kind of comes back to this like people pleasing, right? And like it's kind of like, is there like this happy medium of people pleasing where it's like it's okay to say no, but like it's also still okay to say yes, depending on like the, and how can people measure that out to say like, well, what's defined as people pleasing and what's defined as like me just being like a nice person and being like like appropriate in that situation.
Absolutely. And that's where, right, that's the sense of like where your boundaries lie. And like being a nice person and yeah, like saying yes and whatever it may be may look different for everyone, right? Because everyone may have like their window of tolerance of like, okay, I can do all this stuff, or depending on like what their life looks like. There maybe one person isn't as busy as the other person, right? So like their people pleasing or whatever, their saying yes window is bigger than the other person. So for example, it would be like saying yes or doing things for others to the point of your own detriment. So when you start to notice that your life or whatever you're experiencing is starting to lack, like you're starting to, yeah, build that resentment. So like if you're like helping this person move or whatever, I hate this person. Like, why is he always
Yeah.
asking me that or whatever it is? Or like,
Right.
and then like, or whatever. And then same thing with like if it's affecting your sleep, if it's affecting like, oh, you have all of these plans with your family and stuff, and you're like, oh no, I have to help all these seven other people do this stuff. Or yeah, if it's like if you're happily like, I have no plans, or if I want to do this and I am like happy with it and I am okay with that, that's great too, right? Like if people are like, I have no issue, like this is not affecting me in any negative way, like I still get my sleep, then that's okay too, right? So it really depends on like every person's, I guess, yeah, like every person and their situation, but also like the happy medium of like, okay, where is that of like the saying yes, saying no? It's like, yeah, that's a person. The happy medium, ideally, where we would all like to be, is like the person that has what we call the healthy boundaries. So right, there's always
Hmm.
like the spectrum of like, okay, maybe we have a little bit too much or a little bit too little, or we're just right. But the just
Right.
right is like, okay, maybe this is where like the healthy boundaries lie. So it's like, okay, knowing where you're able to help someone, where you're able to do something for someone else. And then when you're able to be like, okay, no, I have to put myself first or whatever it is. Because otherwise, what happens is we become either two on one in each side. So either it's like too people pleasy, which becomes like, okay, I'm going to be able to do this for all the time, which is called porous boundaries. So they're leaky. We start to just like leak into everyone's lives because we're doing everything for everybody all the time. Or we go the
Hmm.
other way, which is like the total, like very much restricted, like I'm never going to help anybody else. I'm just totally really focused on myself. Where sometimes people feel like that's a bit too selfish. So it's like, okay, where do we have that happy medium, right? And that always just depends on like, okay, what does our life look like and what can we kind of handle for ourselves, our window of control, and what we are okay with, yeah, saying yes to, and just also taking a very look at ourselves and checking in with ourselves like before saying yes. And this is a hard thing for people pleasers also like myself to do, is we don't pause. So this is a good example, or this is a good technique, little thing to utilize if you have this thing that you like to do, say yes a lot before someone, because usually it's somebody calling us, texting us, needing us right away to do something for us. Before saying yes right away, and which is what we're used to, let me get back to you, let me think, like that's it, you just, and that gives you buffer time to think of something else to kind
Hmm.
of say in the meantime, whether that is to acknowledge like, oh, I have free time and I can do this or I can help you, or whether like it's like, okay, no. So that gives you the ability to pause and reflect. So the trick of just pausing and being like, let me get back to you. And no one's going to be like, no, I need that now. Or maybe if they say
Yeah.
that now, then that's a whole other
Then you
situation. But
just, yeah, you say, then the answer's a
then
no.
the answer is
Yeah.
no, right? But if you say, yeah, if you're just like, let me get back to you, that kind of gives you that buffer time of like, okay, do I actually really want to do this? Or am I just doing this for someone else?
hmm Yeah, no, that's a very like a good start to like a boundary script where you're able to like have that in your back pocket of saying that, because it allows that person to then kind of look back in themselves and say like, okay, perfect, right? But again, like getting to the roots of it, like we always talk about like this trauma and like how this is kind of almost a trauma response to like things that they like that have happened, and like whether it's people pleasing or burnout or but how do we define trauma in like a grounded way that makes sense for people?
Yeah, and that's a very loaded question, but I'll try
Yeah.
to answer the best that I can. So I would say like trauma definitely lives more in the body than in the story itself. So it's not just what kind of happened to you, it's what happened without enough support. So whether that was like physical, emotional, or how your nervous system responded in that situation. So like that's why people can experience the same event and have very different like nervous system responses. So for example, like when people say, okay, trauma can be stored in different areas of the body, not just in memories. So if you have experienced like a traumatic event, or if you have PTSD or whatever that may be, because trauma can come up in various different senses, vicarious, etc., all of that, it can be stuck in very different areas of your body. So it's not like it's just something that you keep thinking about over and over again. It can be things that are like physically stuck with you, like somatically within your body, like pains, muscles, not being able to sleep, certain like sensations within your body that really kind of go back to that event, like reliving that event over and over again. And sometimes it's not even like that as well. Sometimes it's just sensations that keep like coming back up. So a lot of times individuals are like, oh, that's something that I went through like years ago, but it doesn't affect me anymore. But I can't sleep. I'm constantly in pain. I have all of these heart issues. I have everything else that's going on. So it's like taking a look at trauma, not at like a one-sided lens, but very much taking a look at it in very different kind of somatic forms of like, okay, what is this opening up within the nervous system? What is stuck? And how can we address that?
hmm When someone says it wasn't that bad, what's like the theme there? What when we talk about trauma, what's usually like the root of that when someone goes like, "Yeah, it wasn't a big deal. It was all right."
And sometimes, yeah, sometimes like we don't really like to acknowledge our own pain. And sometimes it's easier to just, yeah, be able to like just brush it off or not really validate ourselves. And sometimes, depending on what the trauma is, it could be that same reason, right? Like sometimes like people are like, oh, maybe I'm just going to question my own reality because maybe it wasn't that bad, or maybe this, whatever it was. But in that sense of like everybody deserves to have their story heard and listened to,
Mhm,
regardless of what they think of. Maybe it wasn't that bad. Clearly something is still affecting you nowadays that is showing that there is something that maybe is stuck. Maybe it wasn't that bad now, but if we kind of go back and take a look at your life and seeing like your behaviors and patterns and things like that based on this, after this experience, maybe there was something that still is there. And
mhm,
that's where that difficult part is, where with trauma it's like having to like acknowledge and accept that this is something that, yes, I've gone through, but it doesn't mean that it defines you. And going into that is painful and people don't want to do it. So that's kind of like knowing like, okay, sometimes it's just easier to just brush it off and be like, it's not that bad.
And you talk about like trauma being like carried in the body a lot. Uh, when you are speaking with a client or having these sessions, are there like subtle tells that you can tell that like their system is still carrying that trauma?
Absolutely. So we actually have like I have like a little somatic checklist that I sneakily do as well with consent with the client, but it's just kind of watching their body movements, how their shoulders are, if they're very like closed off, if they're very tight holding themselves, if they really react with their eyes, if they don't have eye contact, if they're not comfortable like looking at me in the eye, which is nothing's wrong with them, but it can tell like, okay, something maybe is going on somatically, or they may have experienced something. Same thing if like fidgeting, moving around lots. Also like being like sometimes not wanting to speak about certain things, and that's totally fine as well. And then also watching like pupils, sometimes like moving like um if people have experienced like certain types of abuse, like how they kind of like shift really quickly or things like that. So really just watching body language is huge, like screening for certain things like that, like um, if they talk slower, if they talk faster, things like that, and everything like that. Really, just it really can show that things maybe have been affected in that way.
Hmm. That's really interesting, and that kind of leads us into how we deal with trauma. And one of the things that you are a big, one of the things that's like that you have a big level of training on is EMDR,
Yeah.
and kind of to help with that training. Again, I don't want to. Yeah, I want to cover it, but I also don't want to stretch out the time too long. But I'm really interested to hear this because, like, a lot of times when we talk about therapy, or even the fact, like, you talk about like getting vitamin D, like, there's this level of like hocus pocus around it where it's like other facets of life has almost like diminished the value, or like people are like attributing like one thing to another thing, and so, in plain English, just kind of explain what EMDR is, and let's kind of like take time to like demystify it in a way so people get like an actual like grounded idea of how that can help with like trauma related stuff.
Absolutely. So, without getting into too much detail, because I could talk for hours on this, which I'd love to. But
Yeah.
essentially, so EMDR, it stands for eye movement desensitization and reprocessing. So, what that like means, and I'll go into like a tiny little bit of history because I'm a nut with that. But EMDR, it helps the brain reprocess stuck memories so they feel like something that happened in the past is not currently happening right now. So essentially, what happened to you beforehand, it's going to allow you to now, this day, it's not going to feel the same way. So it's not going to be like erasing the memories. That's what people think, like the hypnosis part. We're not
Hmm.
erasing the memories and we're not reliving the trauma. But what is happening is we are allowing our nervous system to recognize that what happened to us we are able to process in this moment. So, because what happens usually is when we suffer from a trauma, we're not going to be sitting in that trying to kind of be like, okay, I want to sit in this. I want to hang out in this pain. I usually want to run away from it. But what we need is we need for the body and the brain to recognize that we are able to move forward and process these things. So this is what happens in these kind of 8 phase protocol in the sessions. So in that sense, because it sounds like black magic, I'm just going to give you a little bit of history. Um,
Hmm.
so EMDR, it's been around for it hasn't been around for too long, but about like 40 years. Kind of developed like around 1987 by Francine Shapiro, and she was a lady that really enjoyed going out for walks. So she'd go out for walks, and she noticed like when she would be thinking about stressful events, she would take a look at the cracks as she walked. And she noticed, okay, like, why do these eye movements, as I'm thinking of something negative, why do these eye movements make me feel better? So, what she did is she decided to look more into this like, okay, What do these eye movements mean? Why do these eye movements make us feel better when we're thinking of something negative? And what she discovered is that the bilateral stimulation, which is the moving of the eyes, so the left to right movement, is allowing the right and the left brain to communicate with each other. So, what's happening is it's allowing that negative memory to be kind of moved back and forth from one hemisphere to another. And what happens, for example, I'm just going to give you a little example here. So, if this feeling is I am not good enough, and we are processing a memory that has to do with I am not good enough, and we're not having to relive it, we don't have to talk about it, we're just going to think about it. And we are processing, we're sitting thinking about the memory that makes us feel like I'm not good enough. And we have the bilateral, which is the eye movements, or it can be any other kind of stimulation. We're thinking about the I am not good enough. What will happen is your brain will start to naturally allow that feeling of I'm not good enough to die off. And that is where your nervous system starts to feel better. That's where that kind of black magic, where people say that we're erasing memories, but we're not erasing memories. We are allowing the
No.
nervous system to start to feel a bit more okay again. I don't want to use
Mhm.
the word safe because sometimes individuals have suffered things that they will maybe not feel like that word comes up again for them. But just, yeah, feeling more comfortable again in their nervous systems, allowing that feeling to kind of die off. And with those structured phases, with the 8 phases, those phases are very, very important, specifically to EMDR. I can't go too far into the phases in and of itself, but where the history of kind of bilateral stimulation comes from, it's really talking about essentially where the brain has a natural way of healing. And that
Mhm.
kind of leads to what's called the adaptive information processing model, which is just all a lot of science,
Yeah.
AIP model, but it really does allow the brain's neuroplasticity to heal. It allows us to move forward from those painful times and move forward and reprocess in healing and living more of a authentic life. So that trauma doesn't have to define you anymore.
And how, when you're initially starting these sessions, and we talk about like the structure of these sessions, how, where, like, does it like stagger? Does it get increasingly longer? Is it a number based sessions? Like you have to take so many sessions. How does that look like time wise, or like the level of investment that someone would have to put in?
Absolutely. So it really depends on what you're wanting to work on. So if you're wanting to work on the full 8 phase protocol, which is what I usually suggest, where is the root? Because some people
Hmm.
are like, and they don't want to, right? It depends on what they're comfortable with. If they come in with like a situation, they're like, I don't want to keep going back to the same situation. We can do a specific protocol for that. But if we are going to do full phase, 8 phases EMDR, this can take a while because trauma work does take a longer time. It is more of like an investment in yourself. So, for example, what we start off with, like phase one, is history taking. So, of course, I'm kind of getting to know you, figuring out what we're going to be working on, what's kind of going on in your life that's making you kind of seek this, what we can kind of develop, what kind of cognitions are coming up. So
Hmm.
after the history taking part, we go into phase two. And phase two is where we develop all of the grounding techniques, the pendulation, because EMDR is not easy. And we need to have techniques and things for us to kind of go back to ground you while we're doing these things, while we're doing these
Hmm.
processes. So phase two, we kind of spend a little bit of a longer time in it because we want to make sure that the client is comfortable. We want to stay within their window of tolerance. We usually utilize these different grounding techniques, kind of like the container, the calm place, and other different pendulation techniques, so that when you're feeling really activated in the body, we have them to kind of take you back to really like just calm you and ground you.
Hmm.
And then after kind of phase two, when we're feeling like, okay, we got these grounding techniques, because it's kind of like preparation, right? We can't just, we're not going right in there. That's, we, with trauma work, we gotta build slow and then kind of flow into it. So after phase two, we go into phase three, which is kind of assessing and getting ready for processing, which is phase four. So, phase three is we're getting our negative and positive cognitions ready. So, for example, like I said, that I'm not good enough. kind of making sure that we know what memories, what targets we are working on. This is kind of what I tell the clients, like, this is kind of our last session before we get into the fun, nitty gritty stuff, AKA the uncomfortable stuff. And essentially, when processing starts, when the bilateral and the memory work starts, is phase 4. And phase 4 is kind of the place where we take the longest amount of time. Because depending on what we are working on, depending on the types of memories, depending on how much emotional connection they have to us, this is where it can take a little bit longer, because everyone can process differently. It really depends on your brain, your age as well. Like, kids can process quite quickly as well. It really just depends on you in and of itself. But for example, I'm just going to give you like a very brief, like, mini target plan of what would look like. So where processing would start is, and it doesn't have to, but we can start, let's say we're going to start from childhood, because we're going to start from the root, but it doesn't have to start like this. We're just going to say that we're going to start it like this. So I'm not good enough. We are going to go to kind of the first time that you felt this way, that I'm not good enough came up for you. We are going to process that, however many sessions that may take, because it depends on the memory, depends on what comes up for you. Then we move forward to the worst time that we felt like I'm not good enough. And there's something that's coming up for everybody knows. Then usually, depending on, again, how emotionally strong this is, it can take however many sessions to process the worst. Then we go to current. So that is nowadays, feelings of nowadays. I'm not good enough. Same thing. We process those with the bilateral, however many times that may take. And then we go into future installation. So if we ever feel like this may happen again, like feelings of possibility, like of I'm not good enough in the future, and we then process those. And then after that, we go kind of into the other phases, which will take me a little bit longer to talk about. So I'm not going to go too far into it. So
Yeah,
like
of
phase
course.
6, 7, and 8. But those are kind of when we go into those phases, is once we've processed that negative belief. So once we go
Right.
into kind of phase 6 and 7 and 8, phase 6 is focusing on like the positive cognition. So instead of feeling I'm not good enough, what would we rather feel like? I am good enough regardless. And we're really focusing on strengthening that belief. Because once
Right.
we reprocess the negative, once we kind of take away the I'm not good enough feeling, we need something to replace it with. So we need that positive feeling instead. Then
Right.
we continue kind of to move throughout that. We have different scans, we have lots of body work that we do to make sure that there's nothing residually stuck. And I don't want to go too far into the phases now, but essentially what we do is we really make sure that that feeling, that negative cognition, kind of dies off in and of itself. And we really
Right.
check in with our bodies also, and the body sensations, to make sure that nothing is also residually stuck within there.
Mhm. Is
And
there
that's
a
just in and
point?
of its
Yeah.
nutshell. So I hope
That's
that I didn't
no,
confuse
that's
you.
amazing. No, that's amazing, and I think it gives like a very good overview of like the whole process in itself. One question that I do have is is there like a level of prior therapy, or like I want to say like stabilization, like I'm assuming that like someone that's in like the midst of crisis, this wouldn't be like appropriate to do. And is there like that factor, that measurement tool that you need to use to determine whether or not this is like a suitable like program or a suitable type of therapy that would be
Absolutely.
beneficial?
Yeah. Yeah. So definitely, like, trauma work is not something that you just kind of jump into. Um, I wouldn't suggest it for, yeah, like crisis for sure. But if you are feeling like kind of like, because not everybody's always gonna, we're not always gonna be like ready or okay, right? So if
Mhm.
you are able to kind of sustain your, not even like, just being able to talk about your memories and talking about things that have happened to you, that's already a great step in the right direction. So if someone, like, this isn't like also a talk based therapy. So if you also feel like you're not able to talk about things, but you're feeling like you're ready for a change, and like you're feeling like the same patterns that are happening over and over again are not serving you, so that you're kind of like in maybe at a wit's end, this is
Mm-hmm.
something that I would definitely suggest trying, but
Mm-hmm.
also in a sense of like, because we don't want to like do too, like, we don't want to push you within your window of tolerance. So for example, like even if someone is coming in just for kind of talk therapy, and I, for example, suggest or think that they would be a good candidate for EMDR, and they're like, absolutely not, I'm just not ready to get into that, then that's totally okay. Because with EMDR, we really want to make sure that we are just moving within your window of tolerance, because it's
Mm-hmm.
not easy. Like it's difficult work, but it is such beautiful, beautiful work, and the progress that you can make is amazing. But for example, like, yeah, crisis intervention, I would not suggest. But like when I did work in a rehabilitation center with like substance use, I wasn't using EMDR for individuals that were like actively using, but individuals that were like 6 months sober, or like they were like, I'm ready, like absolutely totally okay. It's really also based on like the individual itself, or who they are and what
Mm-hmm.
they want, and like also physical aspects too, like brain injuries, things like that, stuff like that that we don't want. But also there's also modifications. Like with EMDR, there's not like, you don't have like, there's modifications to what your experience is as well. But yeah, like I would recommend it for everybody otherwise. Definitely not like age limited or anything like that. Like I've done EMDR with children, seen beautiful effects. Same thing with, yeah, adults, youth. And yeah, I wouldn't suggest it for individuals that are just kind of not ready in and of itself to kind of explore that yet, or yeah, or crisis work.
Is there ever this like notion that like you're kind of like building a house of cards where it's like if I offer too much too fast, it's going to almost like cripple all of the work that we've done if I like if they're not ready for this or something like that, where it's almost like you have to like in some way like be very like like you have to have some tact
Yes,
about it because it's like, oh, if I like do too much, it's like, well, now everything that we've worked on, it's like
absolutely.
I could almost like send them right back into that like moment.
Absolutely. Yes. So that's why you have to really like, that's why we work within, yeah, we talk about the window of tolerance a lot, is like we make sure that we go very, very slow and steady, and like what you are able to handle and want to handle, just to make sure that we don't do more harm than good. Because yeah,
Hmm.
like for example, if somebody has is like very much like currently, and yeah, like in current distress or things like that, that are just, yeah, it's not the right time, or maybe experiencing a lot of dissociation, or just not within the body, or whatever it may be, it's okay to not move forward with that, or like take a pause, or spend a lot of time in like resourcing, which is phase two, just like grounding, making sure the individual feels comfortable. But yeah, not moving forward, like making sure that like moving forward too fast can definitely be not a good thing as well. So just really taking it slow, and trauma work is slow, but that's okay. That's okay, because like slow and steady wins the race.
That's right. That's right. Um, I'm interested too. Uh, before we kind of get into like our wrap up questions, I want to thank you for being so like an information source and on so many like great things that people that are listening can take away from this interview, whether that's just understanding trauma or burnout or the differences between depression and burnout and stress, as well as just being so candid. I want to say thank you so much. But I kind of want to get back to you as the focus and kind of asking questions about, this whole journey with the building beyond roots and like posing the question, like, what do you think was like the most, like, what surprised you the most about building a practice like this and, being a business owner?
Yeah, well, the first surprise was definitely how much like they don't teach you any of this in school, right? Like they just kind of teach you like, this is how to be the blank slate therapist, this is the rules you must follow, and this is it, right? And that was not what I experienced being like a therapist actually in real life. Like you definitely we have certain like techniques and modalities that we follow, but we're all like, yeah, we're all different, we're all human. And what I've noticed is like being like yourself within like a realm of people that maybe are, yeah, either like trying to do the same thing as you, right? Like, so you really have to put out your authentic self, which I wasn't like, it wasn't like I wasn't ready for it. It was like I was ready for it, but I didn't know that people actually wanted that. I was like, oh, okay, this is going to be great, like, because it's like, okay, now I can showcase like being able to help people, but also like the values of Beyond Roots and like what that is. And then also like
Mhm.
learning all of these like behind the scenes business aspects, a lot of like a lot of DIY googling and YouTubing and calling of dads and people in my
Yeah,
life
of
that have like
course.
started their own things. But honestly, like just recognizing that, just like the word of like keep going and like practicing what I preach, like in that sense of like, okay, I tell my clients that they can like do anything and that they can like succeed and that I'm there for them. So I'm like, okay, you know what? This is like a huge leap of faith, but you know, I got to do it. And I think it's definitely been a good thing. And yeah, if I can help one person, I am just really happy with that. And being myself is something that I'm okay with. And if people like that, then I can definitely do that, because it's like I want to be able to help other people feel like they can be themselves, like they're not too much. So it's like I have to also feel the same way about myself.
Of course. And do you find that there's a balance to actually being a business owner as well as like being a therapist? And like, how do you balance them without like losing your kind of like without losing like your heart for the job? Or, is there that level or like that kind of introspective that you might have where it's like, how much do I need to give attention to both sides of this? And like, if I care too much about the business and less about the therapy, then like I'm not there for my client. And like what things do you do to keep that kind of balanced?
Yeah, and I would say I definitely like I am always like caring about my clients first. That's just always how I've been, in that sense of like client care and just being there for my clients, but also, yeah, knowing like that, like being a business owner and having like certain boundaries and certain policies and things that I need to have, to also like protect myself, but also help like clients experience better care, and like knowing that I have to do this for myself. So like, yeah, the practicing what I preach within like the setting of the boundaries, but also knowing like, yeah, like I am definitely like a therapist and like a carer first, I would say, for sure. But also knowing like, yeah, like there are things that I need to make sure that I like get set as a business owner. But that's why I have like certain like lists and things like that, but also knowing like I have to kind of like be able to manage myself and put both of those capes on, but also take them off, like, and be okay with that too.
Hmm. And when people are looking to find like the right fit for a therapist, like is there like a criteria that someone should have? Like, is this an individualized thing, or is there like a set like kind of like rubric or like criteria that like a perspective like person that's looking for therapists like look out for? And like how can someone determine whether or not a therapist is the right fit for them?
Yeah, absolutely. And I always tell people, I'm like, therapists, like a good fit, like it is literally like shopping. You really have to like try around and see like what feels best for you. And especially like if you've never been to therapy before, it's like the best time to just kind of like go and search and take as many free consultations as you want, just to see how comfortable you feel. Um, just making sure like if you feel like what kind of energy or what kind of like vibe you feel like while talking to the person, like does this person feel like I want, like, do I feel comfortable? Do I feel like am able to talk to this person? Like what kind of energy do they give off? Like, am I comfortable? Like, do I feel heard even in the consultation, or do I feel like judged, or do I feel like this is a bit too like booky or clinical, or like, is this person more social and like I can laugh and they'll be happy or they'll be okay with that, or kind of what am I looking like for in that sense, in a like what would make me feel comfortable. But also, yeah, trying those things out, like being able to also, like when people tell me, like when I do consultations, they're like, I just want to let you know you are not the only therapist that I'm talking to. I'm like, good.
Mhm.
I'm like, please shop around, because I totally, this is very important. We need to be a good fit. Like if you feel comfortable, if you are like more of like a reserved person, or if you're, yeah, into like, some people are like, they love, yeah, like the tattoos, awesome hair. People look that up. Absolutely. Like animal lovers, huge people, right? Like people that like the like support your values, your views, all of that, whatever you feel most comfortable with, right? Because if you have somebody that does not support your views, they're not, that's not going to be a good fit. And that's okay.
Mhm.
Like that's okay, right? Because not everybody's a good fit for everybody. But once you know, like you're like, okay, this is my person. Like I'm like, oh, this is someone that I can talk to, right? And it's very difficult to reach out for therapy or even have a consultation first, because you're just being vulnerable with someone that you don't know. So it's just like having that feeling, and you'll know, like you'll have a gut feeling in your heart and like your body, like, okay, this is what I'm looking
Yeah.
for.
Yeah. That's amazing. And Lily, thank you. Seriously. Uh, where can people find you?
Yes, find me. Yeah, so my website is beyondrootscounseling.com. You can also reach out there directly if you would like to contact me to set up a consultation, a 15-minute free one, or if you just have questions about anything at all. And then I am on Instagram with at therapy with Lily, and that's the same thing for TikTok. But yeah, that's basically where I'm at. You can also look
Yeah.
me up if you want, and there's other stuff that you can find, like Facebook and LinkedIn. But yeah, basically my website and my Instagram.
That's amazing. I think this is one of those conversations that's going to help people feel less confused and a lot less alone when they're thinking about how they're living life and experiencing burnouts. For the audience today, if you're listening and this episode hit today close to home, just remember you're human and you don't have to carry it all by yourself. We'll link Lily's practice Beyond Roots Counseling plus her socials and booking info in the description. If you enjoyed this episode, hit subscribe, leave a comment below, and send it to someone who needs it more than they wish to admit it. Again, thank you to Lily for coming on and
Thank you
everybody
for
to
having me.
watching. Yeah, of course. And I can't wait to break down this what I like to say now is the therapy vocabulary and kind
Oops.
of getting and getting down to like the deep roots of it because I think there's so much more to explain. So I can't wait to link up in the future and kind of deep dive on some of these subjects. But yeah, this has been amazing. And again, don't forget to like, subscribe. This helps us get amazing guests like Lily back onto Solo Spotlight. And we will see you for another one next week.